Fentanyl, a name that has become synonymous with both life-saving medicine and devastating public health crises, is one of the most powerful synthetic opioids known to medical science. Originally developed in the 1960s by Belgian chemist Paul Janssen, fentanyl was created as a potent pain relief medication for use in situations where other opioids, such as morphine, proved insufficient. As much as 50 to 100 times stronger than morphine, fentanyl can bring relief to patients suffering from intense pain, such as those recovering from major surgery or experiencing the unrelenting discomfort of advanced cancer.
In the hands of trained medical professionals, fentanyl can be a crucial element of modern pain management. It is typically administered in controlled environments, like hospitals or clinics, most often via injection, intravenous drip, or as a patch that delivers the medication slowly over time. For these patients, fentanyl's unmatched potency can mean the difference between unbearable agony and manageable pain. Its rapid onset of action is especially valuable in settings where instant relief is required, such as during anesthesia or in emergency care.
But with great potency comes great risk. Fentanyl's central mechanism of action is to bind to opioid receptors in the brain and spinal cord, blocking the transmission of pain signals and producing a sense of euphoria. This same mechanism, however, also suppresses breathing, particularly when the drug is taken in excessive amounts or in combination with other substances like alcohol or benzodiazepines. The margin of error, the difference between a therapeutic dose and a fatal one, is perilously small.
In recent years, fentanyl has become infamous not only for its legitimate medical uses, but also for its role in fueling an unprecedented opioid overdose crisis. Illegally manufactured fentanyl, often produced in clandestine labs and distributed through illicit channels, is far more potent and unpredictable than most street drugs. A tiny quantity, as little as 2 milligrams, equivalent to a few grains of salt, can be deadly.
Part of what makes fentanyl so dangerous outside medical settings is its invisibility. It is often mixed with other drugs such as heroin, cocaine, or counterfeit prescription pills, frequently without the knowledge of the end user. These adulterated substances are virtually impossible to distinguish by sight, smell, or taste, leaving unwitting users exposed to sudden and severe overdoses. The breathing centers of the brain can shut down within minutes, causing hypoxia, brain damage, and death, unless immediate medical intervention is available.
The rise of fentanyl in the illicit market reflects a broader shift in the dynamics of drug trafficking. Because it is synthesized in laboratories rather than derived from natural poppy plants like heroin, fentanyl can be produced cheaply, in large quantities, and in locations far from traditional trafficking routes. Its extreme potency makes it easier to smuggle. Smaller volumes pack more doses, making detection and interdiction more challenging for law enforcement.
Communities across North America and beyond have felt the impact of fentanyl's proliferation. According to health authorities, overdoses involving synthetic opioids like fentanyl have driven a sharp increase in drug-related deaths. Families are shattered, and healthcare systems are strained as emergency responders race to reverse overdoses with naloxone, a life-saving medication that can quickly block opioid effects if administered in time.
Efforts to stem the tide of fentanyl-related overdoses are multifaceted. Law enforcement agencies target traffickers and suppliers attempting to disrupt the flow of illegal fentanyl at the source. Public health initiatives aim to educate both the general public and people who use drugs about the dangers of fentanyl, the importance of test strips that detect its presence, and the critical need for carrying naloxone. Treatment programs for opioid use disorder increasingly incorporate medication-assisted therapies, counseling, and community support, recognizing that addiction is a complex medical condition best addressed with a compassionate, evidence-based approach.
Another facet of the response is rooted in harm reduction. This approach recognizes that, for various reasons, people may continue to use drugs and seeks to minimize the risks associated with that use. Programs that provide access to sterile syringes, supervised consumption sites, and fentanyl test strips all play a part in helping users avoid the most catastrophic outcomes. Increasingly, public health experts advocate for the widespread distribution of naloxone so that overdoses can be recognized and treated immediately, even before emergency teams arrive.
Nevertheless, the challenge remains immense. Fentanyl is not just a public health threat. It is a symptom of deeper societal issues, persistent pain, both physical and emotional, economic hardship, isolation, and gaps in the healthcare system's ability to meet basic needs. At the heart of the crisis are human beings, people who, for myriad reasons, find themselves at risk, their lives and futures hanging in the balance.
In some ways, the story of fentanyl is one of duality. On one hand, it is a marvel of pharmaceutical progress capable of controlling pain that would otherwise be unmanageable. For countless patients, it offers comfort and dignity at the most vulnerable moments of life. On the other hand, in unregulated and dangerous circumstances, it becomes a silent killer, often striking swiftly and without warning.
Awareness, compassion, and coordination are crucial in confronting fentanyl's impact. Communities that have made the greatest strides in reducing overdoses and deaths are those where a multi-pronged approach brings together healthcare providers, law enforcement, educators, social workers, and people with lived experience of addiction. They focus not only on stopping the flow of drugs, but also on supporting the people affected, offering treatment, hope, and a path to recovery.
Ultimately, fentanyl is a powerful reminder of the double-edged sword that some of the world's most effective medicines can represent. It challenges us to be vigilant, thoughtful, and humane in our responses as a society. By continuing to develop smarter policies, invest in prevention and treatment, and cherish the dignity of every individual, communities can strive to balance the legitimate benefits of these powerful substances with the need to protect against harm. The goal is not only to save lives, but to create a future where healing, understanding, and compassion prevail.